All right. Hi, everyone. Thank you for joining our webinar. My name is Harper Byers. I'm a program coordinator at School-Based Health Alliance, and I'm thrilled to be hosting you this afternoon for our webinar, Bridging Health and Nutrition, Food Assistance Strategies for School-Based Health Centers. Some quick reminders before we get started with content. Please use the Q&A icon or the chat to ask any questions as we move through our content today. Make sure that you are chatting all panelists and attendees before typing a message. If you need the closed captions on, please press the button at the bottom of your screen. And we ask that you complete our evaluation poll questions at the end of our presentation today. And with that, I am pleased to pass it over to my colleague, Addie Van Zwal.
Hi, everyone. Thank you so much, Harper. So today we have some pretty lofty goals. So we are hoping that we can help you gain an understanding of SNAP, so the Supplemental Nutrition and Assistance Program, also known as food stamps, and really its role in improving food security and health, and reasons maybe why families might not participate. We're also going to provide you with a lot of resources in terms of outreach and really kind of arm you with the best practices and practical strategies, including SNAP outreach activities in your school-based health centers. Next slide. So, as I had mentioned, I'm Addie Van Zwal. I'm a director here at the School-Based Health Alliance. Today, you will hear from my colleagues, Sarah and Corey, both from Share Our Strengths, No Kid Hungry program. And then we also have a presenter, Sam from MRelief, and I will have them introduce themselves as they get ready to introduce their slides. Next slide. So I did want to start out by giving a very brief overview about what a school-based health center is. I know many of you who have joined us today are from school-based health centers, so bear with me as I do know that there are some participants on this call that are from other organizations and may or may not know or be familiar with the school-based health center model. So school-based health centers really offer the most comprehensive type of care to support student health and well-being. They are generally located in or near a school, prioritize providing health services for students, and at a minimum, really provide services that include comprehensive primary care. And then they may also provide additional services like mental health, oral care, vision care, and other services. I think one of the most important things to highlight is that school-based health centers work with existing school services and do not replace school personnel, nor do they replace primary care providers in the community. Next slide. So just another quick slide on school health centers. They are a unique model of care, and so oftentimes providers need a little bit more time for relationship building. There's a lot of flexibility. Providers need to know how to manage HIPAA and FERPA, and that there may be some more time spent with crisis consultation, and productivity and sustainability might look different in a school-based health center versus a primary care setting. Next slide. So one thing that I think is very relevant to our webinar today is related to supporting students and their families in addressing social determinants of health. So things related to economic stability, healthcare access, social and community contests, making sure people have the right access to education, and really kind of supporting their needs that are identified. Next slide. So last year we completed our census and we took a look at all the different ways in which school-based health centers were obtaining or screening for social determinants of health. One that I wanted to point out here is that food security question. So 59% of the respondents, so we had about 1,500 school health centers respond to our survey. About 59% of them said that they were doing something to address that food insecurity. So just wanted to highlight that as something that many people are already doing, and we want to continue to help support and grow that work. Next slide. So now that you have a little bit of an understanding of school-based health centers, I wanted to introduce us at the School-Based Health Alliance. So the School-Based Health Alliance has been working to improve the health of children and youth by advancing and advocating for school-based healthcare. Since 1995, we've really been supporting and advocating for this high-quality care in schools, particularly working with the most vulnerable children. Working at that intersection of school and health, I think makes it really helpful to students and families to be able to meet their needs where they are seen most of the day. So we do believe that all children and adolescents deserve to thrive. And school-based health centers are a great way to be able to meet those needs. With that being said, I will pass things over to Sarah to talk a little bit about No Kid Hungry and her work.
Great, thanks, Addie. Hi, everyone. My name is Sarah Mills. I'm a senior program manager with Share Our Strength. For those of you who might not be as familiar with our organization, we're a national nonprofit dedicated to ending hunger and poverty for children and their families. Share Our Strength created the No Kid Hungry campaign to make sure that every child in the U.S. gets access to the healthy foods that they need to thrive. And we do this through strengthening state and federal meals programs. We work with organizations in all 50 states, providing grant funding, research, providing technical assistance, and supporting schools, state agencies, and nonprofits and healthcare organizations in their work to end childhood hunger. I'm going to turn it back to Addie to talk a little bit about our work together.
All right. So we have been working together for the last couple of years, really to advance addressing food insecurity in school-based health centers. So if you go to the next slide, in 2022, we actually launched a national learning network of 16 school-based health centers representing 12 states across the country. And so that really started our work together, which then informed the creation of our toolkit, which we will provide for you in the chat. But our toolkit is so big and has so many different resources about just how to help support students and families in trying to address food insecurities. And then in 2023 to 2024, so this last year, we shifted our focus slightly. We did continue to support 10 of the original school-based health centers that were involved in that national learning network. But then we also worked with 2 of our state affiliates. So we worked with Colorado and Ohio to help them launch their own statewide learning networks. And so that work was really exciting to really help them build their own capacity to be able to launch and do what we did for the original cohort. Next slide. So we have continued our partnership. So this year we're focusing on working with Ohio and Colorado to really kind of hone in on evaluation and sustainability. We are super excited to launch a national survey. So as you saw in a few slides ago, where we did ask a question about if school-based health centers were addressing food insecurity, this national survey will actually dive a little bit deeper into what that looks like for people. So we're really excited to launch that national survey. And then we're also hosting a webinar series. So the first one is today. So thank you so much for being here. In January, we'll have another webinar focused on food access programs. So we'll talk about ways in which your school-based health centers can really address food insecurity on a continuum. And then our last webinar in March will really focus on the intersection of mental health and food. Back to you, Sarah.
Thanks, Addie. So before we really jump into our main topic, we wanted to just set a little bit of context for the importance of addressing food insecurity. So what you see here is some recent data from the USDA Economic Research Service, which covered the year 2023. And you could see that in 2023, about 1 in 5 kids lived in a household experiencing some level of food insecurity. So that equates to almost 14 million children. So one thing kind of critical to note about these trends in food insecurity is that there was a really sharp uptick from 2021 to 2022, and then food insecurity actually raised again in 2023. Also really important to note is that food insecurity, continues to be highest in households with children, and among households with children, food insecurity rates are even higher for households with income 185% or below the poverty line, households with children that are headed by single parents, and Black and Hispanic households with children. Next slide. So given the kind of prevalence and increase in food insecurity for families and families with children specifically, we want to spend a little bit of time talking about a program that's in place to support these families and to help them to get the food that they need. So that's SNAP, as Addie mentioned earlier. SNAP stands for the Supplemental Nutrition Assistance Program. It's a grocery assistance program where people receive a debit style card to be able to purchase groceries at places where you can get groceries. So grocery stores, even farmers markets, and more recently shopping online as well. So SNAP is actually the largest federal anti-hunger program and the largest child nutrition program in the US. Nearly half of SNAP recipients are children, and 2/3 of SNAP benefits go to families with children. SNAP serves all ages and people, and any US citizen and certain lawfully present non-citizens can receive benefits if they qualify. SNAP is operated state by state, so there are some differences depending on where you live in how SNAP is operated and the income eligibility levels. SNAP also might have a different name depending on what state you live in. So for example, in California, it's called CalFresh. But most importantly, participation in SNAP can have a lot of broad ranging positive impacts for families and the community and schools. So you can see here that in a study recently done by the Center for Budget and Policy Priorities, they identified several health benefits for participating in SNAP. SNAP is associated with reductions in food insecurity prevalence, as well as better health outcomes, better engagement with care, and lower healthcare costs. Next slide. In addition to the health benefits associated with SNAP, SNAP can also support schools and access to other programs. So kids who are enrolled in SNAP can actually be automatically enrolled in programs like school meals or certified for streamlined enrollment in other programs like the new summer EBT benefit. And then the more kids who are directly certified and enrolled in school meals actually brings in more funding for the school. It reduces administrative costs and burden for families and schools, and it can secure more educational funding as well. And of course, when kids have access to these food programs, it means that they're getting the food that they need to learn and to stay healthy. So, despite many of the benefits of SNAP enrollment, there are several families that aren't accessing the program. So even if they might be eligible, it's estimated that 2.5 million children who are enrolled in Medicaid, for instance, and likely eligible for SNAP may not be participating. So even though SNAP and Medicaid have similar eligibility, it's not exactly the same. And again, it really depends on the state that you're in. And applying for one program doesn't mean that you're automatically eligible and enrolled in the other. So this, adds burden to families trying to fill out multiple applications. Some states are trying to work on that by creating, a joint application for multiple programs to reduce that burden. Some states are also looking at matching data between families who are enrolled in one program and likely eligible for others to help with addressing that gap and outreaching specifically to families. But there still are just many people who are experiencing barriers to access. Next slide, please. So, many barriers are in the way for folks who are trying to apply for these programs. One important one is just awareness, not knowing what the program is, what it provides, and how they might qualify, or if they qualify. This might be particularly true for families who have had, a recent transition or life event like a job loss, or for families with mixed immigration status. There's barriers, like I said, to the application process. There's complicated paperwork. Families often need to fill out many different applications for different programs. That there's also language access challenges with lack of transportation to get to an appointment, internet access challenges, and difficulties with providing the required documentation for these programs. In addition, there's still a lot of stigma about receiving these programs or participating or needing assistance that prevents people from seeking it out. And concerns that SNAP application or SNAP participation could impact someone's citizenship process or cause problems related to their immigration status. And then finally, people have often had negative experiences with these programs or interactions when trying to access these services in the past. And so that has turned them off from seeking out the support of these programs. Next slide, please. So what can you do as a school-based health center, to help families learn about these programs and get connected to the support that they need to apply? We feel like SNAP outreach can really be a low lift or low capacity needed activity for your health center to really engage in, and it can have a huge impact by identifying families who could be missing out on these programs and then connecting them to that significant source of food support. So particularly as a health center that serves kids, you have a really critical role to play. In March of 2023, a rapid national survey of families with young children included some questions about caregivers' experiences with their children's healthcare provider, and really found that overall families reported a high level of trust in their child's healthcare provider. And in particular, parents reported that they would be positively influenced to apply for SNAP if their child's healthcare provider recommended it. So these, survey findings really highlight the important role that you can play in connecting families, and really by helping to reduce that stigma, normalize SNAP access, and really prioritize food access as a health promotion program. So to talk a little bit more about some of the resources that are available to help you with the SNAP outreach process and some of the best practices, I'm going to turn it over to Sam from MRelief, and then Corey, my colleague, to talk through some of the ways that you can go about doing the SNAP outreach. Sam?
Thanks, Sarah. Hey, everyone. Nice to be here with you. Yeah, my name's Sam, and I work on the partnerships team at MRelief. So MRelief is a nonprofit that uses technology to make it easier for people to access SNAP benefits. And we address some of the barriers to SNAP access that Sarah just spoke about. So I'm super excited to be here with you to share a bit more about our organization and our SNAP eligibility screener in particular, which is a resource that all of you can use to support the families and students that you serve. So next slide. Yeah, so today I'm just going to provide a bit of a background on MRelief. Then I'll give a brief overview of our screener. And finally, I'll share a bit more information about some of the results that we've achieved so far. So first, I'd just like to provide a bit of background on who we are and the problem that we're working to solve. So MRelief exists because every year $13 billion in food stamp benefits and SNAP benefits go unclaimed. And this is money that people are entitled to that millions could use to buy food, but they don't. Sometimes they don't know about the program, and sometimes because they find the whole process from determining whether they're even eligible for SNAP to completing often lengthy and confusing applications too complicated. So MRelief is a nonprofit, next slide, and we are trying to solve this problem. So at MRelief, our mission is to transform access to social services for the inherent dignity of all people. And in doing so, our vision, next slide, is to ensure that anyone can access the social safety net without adding to the already stressful circumstance of poverty. So you can go to the next slide. We've developed a SNAP eligibility screener, which I'll describe in a lot more detail in a moment. That's available in all 50 states and in 3 territories. So whether on a computer or a smartphone with online access, or just via SMS text messaging on a regular feature phone, which I guess most of us don't really have access to anymore, but we want to make sure that our tools are as widely accessible as possible. Clients can find out if they're likely eligible for SNAP in about 3 minutes or less. And so this map here really just shows that throughout the country, our screener is available. And then in some states, we have additional products available as well, such as our simplified application, which is available in I think about 13 states, which makes it easier for folks to apply for SNAP than, say, going through the state website. And then we also have partnerships in a number of states with organizations like food banks that provide SNAP application assistance. So next slide. We make our tools available via text messaging and mobile-friendly online forms because a large portion of our target audience doesn't have regular access to smartphones or the internet. And so that just makes text messaging an especially important point of access for our clients, and the screener is accessible via text as well as just a mobile-friendly website. So next slide. Now that I've covered our background, I'll talk a little bit more about our SNAP eligibility screener. So first, just quickly, I thought it'd be helpful to explain why SNAP screening is valuable. So first, it raises awareness. So 80% of people who complete our screener are likely to apply, are likely eligible for SNAP. So folks maybe didn't know about the program, didn't know if they qualify. Turns out that 80% of the people filling in our screener likely do. It's also quick and accessible. So clients can complete the screener by answering a few short questions. That takes less than 3 minutes. And then finally, when folks screen likely eligible, we can provide them with resources that they can use to easily apply for SNAP. So simply put, eligibility screening helps increase access to SNAP. Typically, the way this process would work for students and families, next slide, is that you would let a family know about our SNAP eligibility screener by either sending them the link to our screener or providing them with flyers that the School-Based Health Alliance is creating. So these flyers, you can see like an example of a flyer that MRelief has put together on the left-hand side. Provide simple instructions on how to access the screener online or via text, as well as a QR code linking to the screener. So once a family then accesses the screener, they can check to see if they're likely SNAP eligible. And so now I'll walk you through what the screener process looks like. And you can see an example of how the screener looks for a client completing it on the right-hand side here. So also, I just want to flag that I'll go through some of the details of what the screener asks in this presentation, but you don't really need to retain this information. I know the slides will be available afterwards, so you can certainly look at all of this. You can also access the screener and play around with it yourselves, but really it's the screener does all of this for you. So you don't need to be an expert in SNAP eligibility, for example, because we've input all of the eligibility rules and requirements for each state into the screener already. So next slide. So the screener starts by asking families for their zip code. So you enter that, and then next families are asked if they're currently receiving SNAP benefits. If they're currently receiving SNAP, they may be directed to call the SNAP office if their household size has increased, if they need to recertify for SNAP, or if they need to update their case information. You can go to the next slide. This is just an example of some of those follow-up screens, but I'll move on. So next, families are asked about their household size, and SNAP eligibility is largely a product of someone's income, potentially assets, as well as their household size. And using that and some other information that we capture in the screener, households can determine whether or not they're likely eligible for SNAP. So next slide, if multiple people live in the household, you'd select multiple people in the household option and then choose their household size. And then we ask applicants if they're 60 or older and if they're receiving disability benefits. If they answer yes to either question, they then have an additional question to answer about the amount of money they have available to them in the cash or in the bank. And then next slide, they're then asked about whether they have income, whether they've received income in the last 30 days. Next. And if the answer is yes, they are asked about their total income before taxes in the last 30 days. If their income in the past 30 days is above a certain income threshold, then we ask them if they expect to continue receiving that income over the next 30 days. Again, like all of this is just information that helps us determine someone's likely eligibility. And we're doing this because the process of finding out if you're eligible can be pretty complicated if you just have to go to the state website and navigate this yourselves. So next slide. So families are then asked about their citizenship or immigration status. Next slide. And next they're asked if they're a student. And if their answer is yes, they're asked to select which categories pictured here apply to them. And then finally, they are asked for their phone number in order for us to provide updates. So then, next slide, they receive an answer as to whether they're likely eligible for a SNAP. And likely eligible here just means that we're determining their likely eligibility since it's ultimately the state that's making the real determination as to whether somebody's eligible, with even more information that we're getting here because the screener, we're not asking people to provide personally identifiable information, really. It's just a way for us to ask as few questions as possible while still getting enough information to make an assessment about eligibility. Okay, so if a client is likely eligible for SNAP, we give them the option to either apply on their own using potentially in some states, those like 13 or so I mentioned are simplified application, choosing that apply on my own option. So a simplified application just makes the SNAP application process a little bit easier for folks to navigate themselves. And then in states where we don't have a simplified application, we direct folks to the state website where they can also apply on their own. So depending on their zip code, some families will also be able to select the apply with assistance option. And so this option is available in communities where we have a partner like a local food bank, for example. In some places, it could even be a school district or like a Catholic Charities agency. And so these organizations have caseworkers available who support folks with SNAP applications because for a lot of people, even with our simplified application, the process is just so complicated that it's really, really helpful to have somebody navigating them through all of these questions on the application. So I'm not going to get into exactly like how all of that works, but it is just to say that hopefully for some of you, we will have those partnerships in place in your communities. And if we don't, and you know an organization that's doing SNAP application assistance, you can definitely bring them to our attention and we'd be happy to talk to them because we do find that it's really important for folks to have access to that application assistance, that finding out that you're eligible for SNAP is very valuable in itself, but it can be even more impactful to have somebody really walking you through that process, at least for a lot of clients. So next slide. And then if a family screens likely ineligible for SNAP benefits, we still do our best to link them to resources to meet their food and other needs, because we know a lot of folks, even if they're SNAP ineligible for whatever reason, still need access to food. So yeah, again, here's a quick summary of how families will access this resource. So y'all can promote the screener, potentially using flyers that we'll make available. Those flyers will have information about how to access the screener via a QR code. Families can then access the screener, fill it out, takes about 3 minutes. Then they'll be prompted if they're likely eligible for SNAP to either apply on their own or to schedule an appointment with an advocate or caseworker who can assist them with that application. And again, just to emphasize here that you don't need to know all of these details. We include SNAP eligibility criteria broken down by state in our screeners so that you can simply provide it as a resource to your students and the families that you're serving. So just to close with a little bit of our impact over the years. So to date, we've connected at Mrelief over 4.1 million people to SNAP benefits. And with your support, hopefully we'll connect even more. So once they're enrolled, a household receives an average of $205 per month to spend on groceries, depending on their household size. And ultimately, we've supported clients in unlocking over $1.4 billion in food benefits. So we always like to close with a quote, just because we know that for a lot of people, getting actual in-person support that helps them navigate through this often complicated process can be really meaningful. So that's it for me today. If you ever want to get in touch, feel free to send me an email at sam@mrelief.com, and happy if we have time later on to answer any questions that come up. And I'll pass it to Corey.
Thanks, Sam. Hey, everybody, I'm Corey Himes. I work alongside Sarah at Share Our Strength, where I focus on SNAP, particularly SNAP in schools and summer EBT. And I'll be discussing some strategies for expanding SNAP outreach, particularly by engaging community partners like schools, school districts, food banks, like local governmental agencies, and using diverse communication methods to reach families where they are, and then also by combining multiple touch points particularly around accessible messaging. We can increase SNAP awareness, reduce stigma, and empower more families to access SNAP. And to start off with some best practices for successful SNAP enrollment campaigns. The first thing here is involve multiple touch points to educate families about SNAP, which is a great way to inform SNAP is by weaving educational content into existing school events, like teacher-parent conferences, back-to-school nights, or back-to-school events, sporting events. And we think of this approach as being sort of like a familiar setting to introduce families to SNAP in a way that feels natural and accessible and comfortable. And also by being present at these events, you can meet families where they already are, thinking about reducing barriers to information and engagement. The second thing there is communication campaigns using asset-based language through school channels. And we do this to ensure our messaging is impactful. It's important to use asset-based language in our communication campaigns, particularly by framing conversations around the need to focus more on empowerment and support, showing respect for the family. And also schools can share this messaging through channels that families already trust, like newsletters that go home with their children, social media, and also on school websites. So this is, by focusing on positive, inclusive language, we can encourage more families to engage without facing barriers like stigma. Assistance, enrollment, specific opportunities, direct assistance and enrollment opportunities are essential. And you can create these, by creating designated times or events where families can get help with SNAP applications, can make the process simpler and less intimidating for families. And we've seen this, typically be done at school resource fairs, even at like school office hours or even virtual sessions, where during these times families can really receive the hands-on application support and assistance with someone who's has a really good background and really experience with SNAP that can guide them through self-enrollment or just to be the resource to help them with any issue they may face while applying. All opportunities provide ways to self-enroll and get application assistance from someone like I said that's really experienced with SNAP and the SNAP application process. So it's important that every touch point provides an option for families to self-enroll if they're ready, of course, or to work directly with a knowledgeable application assister. Where we want to empower families to take the lead on their own application, but also want them to feel confident that they have the support if need be. Effective individual level strategies. The first thing is listed is school district-wide awareness and clear referral channels. This is really important. At the individual level, we start by making sure that SNAP awareness is embedded across the school and school districts in general. Staff should be aware of SNAP benefits and have clear referral channels to outside sources. So they meet a family. So if they meet a family that might benefit, they can clearly help them, guide them to the right person that could better assist them. So building school-wide awareness creates a supportive environment where any staff member can be an ally in helping families get the resources they need. Targeted outreach is important beyond general awareness, because families, obviously, and this might mean working with social workers or counselors at the school to identify sort of the supports the family might benefit from by applying for, support or encouraging them to apply for SNAP. And by meeting this specific need of families, we can ensure that no one falls through the cracks. And then I also listed their warm handoffs. And warm handoffs are key to making families feel cared for and supported. This also means that when referring a family for SNAP assistance, we don't just send them, like to anyone or just send them to a very vague, or like not really providing them with the a contact person. So instead, we think of this as introducing them to a specific contact who we already know, that we know will help them walk them through the steps that they need to fully apply for benefits. And again, this personal connection reassures families that they're not alone, and that you know they can trust the source that the school referred them out to. Next slide. Partnership is key. And food banks often provide SNAP outreach and assistance, both virtually and in person. And from what we've seen, food banks are critical partners in SNAP outreach in any community. Not only do they serve individuals who might benefit from SNAP, but they're also able to offer, you know, as we talked about, virtual and in-person assistance. Food banks have dedicated trained staff to support clients in completing SNAP applications, making them well-equipped to connect folks to the benefits they need in the community. So partnering with food banks can really expand reach and ensure families have that consistent support where they are, whether it's online or in person. School districts are uniquely positioned to support SNAP outreach since they have regular and trusted contact with families, you know, and obviously through school counselors, social workers, family engagement coordinators, districts can really provide critical information about SNAP to families. And additionally, you know, as we talked about, school events, newsletters, and online, you know, resources are all ideal channels for sharing that information, making it easier to reach families where they are to apply for benefits if they need that. And then immigrant serving organizations are key. Immigrant serving organizations are essential for reaching families who may face additional barriers to SNAP enrollment, such as language differences or hesitancy due to immigration concerns, which we often find that lots of families are concerned because of their immigration status. And so partnering with these organizations can provide culturally sensitive outreach and may help dispel myths about SNAP eligibility. And then 211 community action agencies, resource sharing agencies are all very, you know, important. Considering they're already doing a lot of this work anyways, they help to connect individuals from various forms of assistance, not only through SNAP, but other critical services that they already provide. And so families reach out to these agencies that are already seeking support, making it, you know, making them more open to learning about and even enrolling in SNAP if they're eligible. And then leveraging these channels can help us reach families who are already looking for other assistance and resources. And then local or state government partners, libraries, you know, we think about social services, health departments, they all interact with the community on a regular, you know, day-by-day basis anyway. So leveraging these partnerships to share information on SNAP is really key. They often already have established connections and resources, so providing them with SNAP outreach materials can really help ensure that families, you know, even, you know, hear more about SNAP from, as we talked about, the trusted sources from those already familiar connections they already have. And you can go to the next slide. Okay, I'm kind of going through this a little quick, so pardon me if I need to slow down here. So with this particular slide, we're talking about SNAP promotion. So the general takeaway when thinking about resources, sharing resources in the community, is that you might want to consider promoting SNAP through a diverse, through diverse channels to ensure you're reaching, you know, a broader audience where they are. You know, so banners, for example, placed in high traffic areas like schools, community centers, grocery stores, you know, really can catch the eye, you know, and provide quick essential information about SNAP, make SNAP more visual and approachable in just everyday spaces. Newspapers, local newspapers reach those who may not be on social media. Ads, articles, testimonials, you know, in newspapers can really raise awareness and reduce stigma, especially among households relying on traditional media. And then social media, you know, is obviously very cost effective and, you know, can reach again, really broad audience. In schools and community organizations often post about SNAP benefits and eligibility through social media, which are really effective ways to reach folks, you know, who use social media, particularly with Facebook. Radio is one, local radio, can reach families during their commutes to work. Public service announcements or interviews about SNAP can really inform listeners in real time, with sort of like hearing it from people that may sound like you or in your community really does is an effective method to get out the word about SNAP and eligibility. And flyers, again, very, very powerful, effective medium to disseminate in the community. It's simple, accessible, easily distributed. They work well in schools, doctor offices, grocery stores, you name it. Really just offering key details about SNAP, about applying, and how to get assistance. Next slide, please. Okay, and this is a really, really good examples of what sort of flyers may look like, really effective flyers that, for if you want to copy and disseminate and you want to create your own, really might want to consider, some of these best practices in terms of like what outreach materials could really look like that are effective in the community. And I'll just kind of go through. I know Sam already talked about the mRelief screener on the right there. That's a really good, example of reaching families where they are through text, or allowing them to talk to someone over the phone to get assistance. But the left flyer there is really a good visual of what an effective flyer could look like, and just kind of walk through like what some of the basics of what's effective. Something that's really eye-catching, a headline. For example, stretch your budget, how to apply for SNAP, as we already see here with these two examples. A simple layout, clean designs with bold fonts. Might want to use some images, plenty of white space. And key sections is, talking about an overview of SNAP, briefly state what SNAP is, or SNAP help families buy groceries. Or like this example, it says SNAP offers eligible households a card to buy groceries. You may want to have something about eligibility, or how to apply, maybe the steps to apply online, by phone or text, as we see with the mRelief example, or with in-person support, and then language and tone. Always want to ensure that you use empowering, inclusive language to reduce stigma. For example, SNAP supports families and individuals. And then you might want to use some really fancy, QR codes, like the mRelief example, where you can obviously get that link to a direct application, or online, or and then obviously you may want to use some partner logos, or trusted local organizations for credibility, and then ensure that versions are available in multiple languages. And then you want to have obviously contact information, website, phone number, and social media links for easy access. Yeah, and thank you. And so with this example, with this slide, I'm really excited to share an example of a successful partnership that was between the Syracuse City School District and the Food Bank of Central New York, where they worked in conjunction to increase SNAP access in their community. And is a really good example that we wanted to highlight today. And so very briefly, the Syracuse City School District served the community with significant, challenges, particularly as it relates to poverty. And as listed there, Syracuse has the second highest child poverty rate among larger cities in the US at 45.8%. And so with that context, the district recognized that there may be many eligible families that were not already enrolled in SNAP assistance that otherwise could be, and they also may have lacked other critical benefit programs that they may have been, eligible for, and they wanted to reach these families. And, but often due to navigational challenges, language barriers, and just a lack of general trust. And so they wanted to address this gap. And so this partnership really was around implementing a comprehensive SNAP outreach and enrollment initiative, where ultimately the goal was to leverage the school district's existing relationships and the role as a trusted, again, a trusted community institution that it could be able, we can better connect families to SNAP. And so working closer and closely with the food bank, the district could provide warm handoffs for referrals and personalized support to help families access SNAP and other benefits they otherwise weren't enrolling or weren't really thinking about. Next slide, please. And so just to talk about some of the very high level key takeaways from that partnership, the district and the food bank was really successful in several ways. But first, we know that nutrition, and food security is critical for learning. And SNAP is a foundational anti-poverty program that provides that long-term support beyond just the emergency food assistance. So secondly, the SNAP referral process from the school district helped build that trust between families and the school system. Families felt more comfortable engaging with the school, which served as a bridge to accessing SNAP benefits. And then the warm handoff between the school district or folks in the school and the food bank was also highly effective. And it was more of like a seamless transition that ensured families received personalized support throughout the application process from a familiar, trusted source. And then the partnership with the school district, other departments like the Office of Family Engagement, nationality workers, and other school social workers were key to the initiative's success. So like that cross-departmental collaboration allowed the district and schools to leverage existing relationships and infrastructure to better reach families who really needed SNAP and who were, not enrolled. But all that to say is that schools are perfectly positioned and aligned to serve as a bridge, connecting families to critical resources like SNAP and other long-term nutrition security and other supports that often obviously is tied to student success. Next slide, please. And what we've learned looking ahead in terms of like sustainability from this partnership is that the district and the food bank obviously are committed to sustaining that potential and expanding the partnership. Even without initial grant funding from Share Our Strength, they're exploring other opportunities that came out of this partnership and this collaboration related to sort of thinking about ways in which they could integrate and streamline the application process for SNAP to connect families to connect families to other multiple benefits, continuing to collaborate with a broader network of community stakeholders and even health centers to address the interconnected issues of hunger, housing, and health outcomes. And then the school district and the food bank partnership really demonstrates the power of leveraging school districts as trusted community institutions to increase access to essential programs like SNAP and other supports. But by prioritizing this collaboration, using lots of data decision making, and a more holistic approach to supporting families, this initiative really had a meaningful and lasting impact on the community in Syracuse. And which is a really phenomenal partnership we just wanted to highlight today. But yeah, that's all I had to say with that, and I think that's the end of my slides.
Right, thank you so much, Corey. And also thank you to Sarah and Sam as well for your presentations. We'll get to questions in a moment, but I wanted to share these outreach flyers that we have created. So as you can see, there's 3 different flyers here. They are available in both English and Spanish. So following today's webinar, you will receive an email from us with a link. So if you are interested in having these flyers, we will create a QR code and specific link that will go directly to your school-based health center. So we're really happy to share that information with you. And so if you are interested in receiving these flyers, just fill out the form and then we will get those to you shortly. So if you go to the next slide, we do have a couple minutes. If anybody has questions for any of our panelists, you are welcome to ask those questions in the chat, or if you want to, you should be able to unmute yourselves if you want to ask the question verbally as well. There's a question in the chat about data on the people who are eligible but not receiving. So I believe you shared that data point. Sam, are you able to reshare that information?
Yeah, I don't actually know that number off the top of my head. Maybe someone else does, and in which case, please jump in. But I will say, I know the number I did share is that $13 billion in SNAP benefits go unclaimed, and that's by millions of people. But I don't know exactly what number of million that is. I want to say it's around 8 million. Sarah, do you know?
No, I can share that the data that I shared in my section too was around children who are enrolled in Medicaid, but not enrolled in SNAP. So kind of using Medicaid as a likely, proxy for likely eligibility for SNAP. But yeah, I can share that, or it's in the slides too, but I can share the source too. Oh, Sam, they're curious about how you get to the 13 billion.
Yeah, I was not the math wizard who came to this number, but that I believe all of this information is publicly available. Like the USDA knows how many people are eligible for SNAP in the country and how many people are accessing it, and then we can make a simple calculation from there on the average amount of benefits that a family or household receives, and multiply the two, and you get to 13 billion. And then to the question on the accuracy of the screener, I would say that it's fairly accurate if you fill in the screener with correct information, because essentially all that we're doing is taking the eligibility guidelines that states themselves offer and presenting it in a more easy to digest format. The state, will occasionally tell somebody that they're ineligible for benefits, even if they screen eligible on the screener, but more likely than not, that's because of an issue with their application. So maybe they didn't submit all of the supporting documents they needed to submit, for example. We try to guide people on that, but yeah. So I would say pretty accurate.
Perfect. So as many of you can see, the closing poll has been launched. So if you could take a couple minutes and please answer those questions. We really value your feedback. And as we do that, I think we can click through a couple more slides and share a few more resources with you before we close out for today. Harper?
Yes, thank you so much, Addie. I'm going to share a couple of links in the chat. First of all, just another link back to our toolkit that we created. It's got a bunch of great resources on there. We also are excited to announce that our call for abstracts on the next slide is for our 2025 National School-Based Healthcare Conference, as well as our Be the Change Youth Training Program. We are open, and we would love to have you submit something about the work that you do or work that your organization is doing. And we just want to put out the save the date for that conference. We will be hosting that in Washington, D.C., June 29th to July 1st of this upcoming year. And I think those are all of the exciting things that we have to announce, but we would love to stay in contact with you. As we've said throughout this presentation, we'll be in contact with those resources and the recording and the slides from this presentation as well. So I hope that you all have a great rest of your day, and thank you so much for joining us today. We appreciate all of the work that you do out there, and I hope you have a nice rest of your week.